What if your body is already sending you signals about your heart health, whispers of a potential issue that you can see right now, just by looking in the mirror? We're not talking about the chest pain or arm numbness we always hear about. We're talking about much more subtle, visible clues on your skin, in your eyes, and even at the tips of your fingers. Many of us are diligent about watching our blood pressure and cholesterol numbers, and that is absolutely essential. However, the story of heart health goes so much deeper than what you see on a lab report. What if I told you that some of the most profound warning signs have nothing to do with a blood pressure cuff at all? What if the clues were on your earlobes, in the color of your skin, in a strange net-like pattern on your legs, or even in the way your fingernails look? Over the next few minutes, we are going to explore 13 of these lesser-known, visible signals that your body might be sending you. We'll count them down, starting with some of the more foundational signs, and building to what I believe are the most surprising and critical warnings at the end. Each one is a piece of a puzzle, a clue from your body that deserves our attention, and you absolutely must stay for the final one. I call it the critical infection cluster, because it's not just a sign of an underlying disease. It can be a signal of a life-threatening event that is happening right now inside your heart. This is knowledge that could truly make a difference. So if you're ready to become a better detective for your own health, hit that subscribe button and join our community. And just a quick, important reminder, all the information shared today is for educational purposes. Everyone's health situation is unique, so please consult your doctor or a qualified healthcare provider before making any significant changes to your health regimen. Let's use this knowledge to have informed discussions with them. All right, let's begin our countdown with a sign that many people experience but may not connect to their heart. We'll start with our clue number 13 because it's so foundational to understanding how the heart and body are connected through fluid and pressure. Our first clue, number 13, pitting edema. Have you ever taken off your socks at the end of the day and seen a deep line indented into your skin that lasts for a while? That's a very mild form of what we're talking about. The real test is to press your thumb firmly against the skin over a bone, like your shin or ankle, for about 5 to 10 seconds. If it leaves a noticeable pit or indent that slowly fills back in, that's called pitting edema. Now, this can be a challenge for many of us as we get older, and it doesn't automatically scream heart failure. It can be caused by sitting or standing for too long, issues with veins, or even certain medications. But when it's related to the heart, it's a clear indication that the central pump isn't working as efficiently as it should. To truly grasp this, let's use an analogy. Imagine your circulatory system is like a city's sophisticated water system. Your heart is the main pumping station. If that station begins to lose pressure, it can't effectively pump water out to the farthest neighborhoods, and it certainly can't draw the used water back efficiently for recycling. Therefore, water starts backing up in the system, and the lowest lying areas are the first to flood. In your body, those low-lying areas are your feet and ankles due to gravity. The pressure builds up in your veins, and fluid begins to seep out into the surrounding tissues, causing that puffy, waterlogged, and sometimes heavy feeling. As a result, recognizing persistent pitting edema is your cue to ask your doctor why the pressure in your system seems to be off. Our foundational sign, number 12, worsening shortness of breath, orthopnea. This brings us to a closely related and crucial sign, shortness of breath that gets noticeably worse when you lie down flat. This has a specific medical name, orthopnea. It's remarkably common for people with this condition to tell their doctors they've started sleeping in a recliner chair or propped up on 3 or 4 pillows, simply because they feel like they're being smothered otherwise. The underlying cause here is the same one we saw in the ankles, but now it's affecting the lungs. When you're standing or sitting up, gravity does you a favor by helping keep that excess fluid from the heart's circulatory traffic jam down in your legs and abdomen. But the moment you lie down flat, that fluid is no longer held down by gravity. It can then redistribute throughout your body and begin to accumulate in the air sacs of your lungs. Think of your lungs like 2 perfectly dry sponges, ready to soak up oxygen from the air you breathe. In this scenario, that backed up fluid from the heart's weakened pump is like a slow leak that begins to saturate those sponges. They become heavy and waterlogged, making them inefficient at their job of absorbing air. Therefore, you feel breathless and starved for air. Propping yourself up uses gravity to help drain the sponges a bit, which is why it brings such immediate relief. This is a classic indication of fluid buildup related to heart failure, and it should never, ever be ignored. Our observational clue number 11, a lacy, net-like pattern on the skin, livedo reticularis. All right, for this next one, take a moment to look at the skin on your legs. Do you ever notice a faint purplish or reddish mottled pattern that looks a bit like a net or a piece of lace? This is known as livedo reticularis. For many people, this is completely harmless. It often appears in children or even young women when they get cold, as their blood vessels near the skin constrict, and it vanishes as soon as they warm up. In that case, it's typically no cause for concern. However, if this pattern is persistent, doesn't go away when you warm up, and is perhaps accompanied by pain or small skin ulcers, it warrants a serious conversation with your doctor. One of the grave causes is something called a cholesterol embolism. Here's a helpful analogy. Imagine you have old plumbing in your house, and over many years, flakes of rust and scale have built up on the inside of the pipes. Now, imagine a sudden surge of water pressure breaks a small chunk of that debris free. It travels down the pipes until it reaches a very narrow section, like the faucet aerator, where it gets stuck and creates a blockage. In your body, the rust is cholesterol plaque in your major arteries. If a tiny piece of that plaque breaks off, it can travel through your bloodstream and get lodged in the tiny vessels of your skin. Therefore, the area downstream from that blockage doesn't get enough oxygenated blood, creating that purplish, net-like appearance. It's a visible sign that there could be unstable plaque in your bigger arteries, which is a significant concern for heart attack and stroke risk. Our conversational clue number 10, the earlobe crease, Frank's sign. Now for something you'd likely never think to check. Go look in a mirror and carefully examine your earlobes. Do you see a diagonal crease running from your ear canal down towards the outer edge of the lobe? This is known in the medical world as Frank's sign. This particular sign is a bit controversial, so let's be clear. It is far from a perfect indicator of heart disease. Many people develop these creases simply as a natural part of aging. But the theory behind why it might be a clue is fascinating and worth understanding. The earlobe is a unique piece of tissue that is supplied by very tiny end arteries. It acts almost like a window into the health of your body's smallest blood vessels. If these tiny vessels are becoming stiff, narrowed, and unhealthy due to widespread vascular disease, the skin and fatty tissue they supply can lose its structural integrity, leading to premature wrinkling and folding. Therefore, the concern among some researchers is that if this process is happening in the tiny vessels of your earlobe, it's likely also happening in the crucial, tiny coronary arteries that feed your heart muscle with blood and oxygen. Think of it less as a definitive diagnosis and more like a check engine light, but for your microcirculation. It's generally considered more concerning if the crease is deep, well-defined, and present on both ears. Consider it a gentle nudge from your body to get your cardiovascular risk factors properly checked out. An insight from your eyes number 9. The grayish-white ring, corneal arcus. While you're looking in the mirror, look closely at your eyes. Specifically, focus on the colored part of your eye, the iris. Do you see a grayish-white or yellowish ring forming around the outer edge of it? This is called a corneal arcus. Much like the earlobe crease, this is extremely common as we age. It's caused by lipid or fat deposits that accumulate in the cornea over time. For most older adults, it's considered a normal and benign part of the aging process. Yet, the crucial factor here is timing. If this ring appears in someone under the age of 45, it is a major red flag. Its early appearance is a strong indicator of very high levels of cholesterol and triglycerides in the blood, which could be the result of a genetic condition like familial hypercholesterolemia. Imagine your bloodstream is a river, and cholesterol is like very fine silt being carried along in the current. Normally, the river flows fast enough to keep the silt suspended and moving, but if the concentration of silt becomes incredibly high, it will inevitably start to deposit along the slower-moving riverbanks. The periphery of the cornea in your eye is one of those riverbanks where these deposits can become visible to the naked eye. Therefore, seeing this ring early in life is a clear signal that the river is dangerously overloaded with silt, and it's almost certainly being deposited in more dangerous places, like the walls of your coronary arteries. A sign in your fingertips number 8, digital clubbing. Now let's perform a quick and simple test with your hands. Press the nails of your index fingers together, back to back, so the tops of your fingers are touching and parallel. Now look at the space right at the base of your nail beds. Do you see a small diamond-shaped window of light between them? If you do, that's a normal finding. If you don't see that window, and your nails curve downwards so the nail beds press right up against each other, this could be a sign called digital clubbing. This occurs when the soft tissue under your nail beds thickens, causing the fingertips to become rounded, bulbous, and sometimes even reddish. This sign is most often linked to chronic lung conditions because its primary trigger is chronically low blood oxygen levels. But it can also be a very significant sign of heart disease. It's often seen in certain congenital heart defects that are present from birth. However, when a physician sees this develop in an adult, it raises immediate concern for a serious infection of the heart valves, a condition we'll discuss in more detail shortly. Here's a way to think about it. Your fingertips are the furthest outposts of your circulatory system. When the body is chronically deprived of oxygen, it can send out distress signals that stimulate the growth of new blood vessels and tissue as a way to compensate. It's like a remote town with a water shortage trying to desperately drill more wells. This overgrowth of tissue is what causes the clubbed appearance. Therefore, it's a physical manifestation of your body's long-term and often silent struggle for oxygen. A critical skin signal number 7, yellowish bumps on the eyelids, xanthelasma. Let's return our focus to the area around the eyes. Do you see any flat or slightly raised yellowish patches, usually located near the inner corner of the eyelid? These are called xanthelasma. They are quite literally little collections of cholesterol that have deposited under the skin. It is very tempting to dismiss these as just a minor cosmetic issue or a simple sign of aging. But medical research shows they are a powerful, visible indicator of what might be happening silently inside your arteries. In fact, several studies have shown that even if your blood cholesterol levels test as normal, just the presence of xanthelasma puts you at a significantly higher risk of heart attack, severe atherosclerosis, and cardiovascular death. The biological process is fascinating. When there's excess cholesterol circulating in your blood, scavenger cells from your immune system called macrophages come along to clean it up. But if they ingest too much cholesterol, they become bloated and get stuck in the tissue, transforming into what scientists call foam cells. Xanthelasma is a visible clump of these overstuffed foam cells. The analogy is straightforward. It's like seeing a few bags of trash piled up on the curb outside a house. It's a strong clue that inside that house the trash is likely overflowing. Those visible deposits on your eyelids are a strong signal that similar and far more dangerous fatty plaques are likely building up inside the walls of your coronary arteries. Therefore, this is one skin sign that should always be evaluated by a doctor. A matter of rhythm number 6, the irregular pulse, atrial fibrillation. This next one isn't something you see but something you can feel, and it's critically important. Take 2 fingers, your index and middle finger, and find the pulse on the inside of your wrist. Close your eyes and just feel the rhythm for 30 seconds. Is it steady and predictable like a metronome ticking away? Tick-tock, tick-tock? Or is it completely chaotic and irregular, with beats coming at random intervals? A random irregular heartbeat is the classic hallmark of atrial fibrillation, or AFib. This is an incredibly common arrhythmia, particularly as we get older, and its danger is often severely underestimated. Normally, your heart's 4 chambers beat in a beautifully coordinated rhythm, but in AFib, the 2 upper chambers, the atria, stop pumping effectively and instead just quiver or fibrillate. This creates a very hazardous situation because the atria aren't squeezing forcefully and emptying completely. Blood can become stagnant and pool in those upper chambers. And what does stagnant blood do? It clots. The real danger occurs when a piece of that clot breaks free, gets pumped out of the heart, and travels directly to the brain, where it can lodge in an artery and cause a massive stroke. Think of the atria like a small pond that feeds into a fast-moving river. As long as there's a healthy current flowing through the pond, everything stays clear. But in AFib, the pond becomes stagnant, like a swamp. Leaves and debris, or in this case blood cells, settle at the bottom and begin to clump together. Sooner or later, a sudden surge can send that clump of debris into the main river, where it will cause a catastrophic blockage downstream. Therefore, identifying an irregular pulse is absolutely critical, as effective treatments like blood thinners can dramatically reduce that dangerous risk of stroke. A strange finding number 5, splinter hemorrhages. Now, look very closely at your fingernails. Do you see any tiny reddish-brown lines that run in the same direction as your nail growth? They often look just like little wood splinters stuck under the nail, hence the name splinter hemorrhages. Now, context is everything here. If you've recently hit your hand with a hammer or done some heavy manual labor, it's very common to get one from simple trauma. That's just a tiny bit of bleeding from a broken capillary, and it's nothing to worry about. However, if you see them on multiple nails, and you know you haven't had any trauma, and especially if their appearance is coupled with feeling generally unwell, perhaps with a low-grade fever, night sweats, or unexplained weight loss, it becomes a much more concerning sign. It can be one of the classic clues for a dangerous infection on your heart valves called infective endocarditis. The tiny lines are caused by microscopic blood clots that have actually traveled from the infected heart valve and gotten lodged in the tiny capillaries of your nail bed. This is a very serious clue, which brings us to our most critical signs. And unusual cluster. Number 4, signs of amyloidosis. The next few signs are quite rare, but they are so distinctive that they are vital to recognize, as they can point to a serious condition called amyloidosis, which can severely affect the heart. This is a disease where your body produces abnormal misfolded proteins that clump together and deposit in organs, making them rigid and stiff. When this happens in the heart muscle, it's called restrictive cardiomyopathy, and it prevents the heart from relaxing and filling properly. The first potential sign is the appearance of waxy, firm, sometimes translucent bumps on the skin, often seen around the eyes, in the folds of the neck and on the ears. The second is an enlarged tongue, a condition called macroglossia. You can often see indentations along the side of the tongue where it constantly presses against the teeth. And the third, and perhaps most dramatic sign, is known as raccoon eyes. This is bruising that appears around both eyes with minimal or no trauma whatsoever. The amyloid protein makes the tiny blood vessels incredibly fragile, so even gently rubbing your eyes can cause them to break and lead to this distinctive bruising. Seeing any of these signs should prompt an immediate medical evaluation. A wild observation number 3, visible pulsations, Quincke's sign. This next one is truly wild, and something you might not even believe is possible until you see it. Have you ever looked at someone's fingernails and seen them seem to blush, turning slightly more pink and then more pale with each and every heartbeat? This is a clinical finding called Quincke's sign. It is a visible manifestation of a leaky aortic valve, a condition known as aortic regurgitation. Normally, your aortic valve is a perfect one-way door that snaps shut after each pump to prevent blood from flowing backward into the heart. If that door becomes leaky or doesn't close tightly, a significant amount of blood that was just pumped out flows right back in between beats. This causes a dramatic and rapid drop in pressure in all of your arteries. Imagine a garden hose with a faulty nozzle that doesn't quite close all the way. When you squeeze the trigger, water shoots out with high pressure, but the instant you release it, the pressure in the entire hose plummets as water leaks back out of the nozzle. This huge swing in pressure throughout your body, from very high during the heartbeat to very low between beats, is what causes visible pulsations in the tiny capillary beds, most easily seen in the fingernails. It's a clear sign of a major plumbing issue in the heart that puts immense strain on the muscle and can lead to heart failure if left unaddressed. Our penultimate warning number 2, painful bumps and painless spots, Osler nodes and Janeway lesions. We now return to the most serious signs of that heart valve infection we mentioned earlier, infective endocarditis. This is a dangerous condition where bacteria or fungi get into the bloodstream and form destructive clumps called vegetations on your heart valves. To understand the danger, think of these vegetations like tiny, fragile bits of cauliflower growing on the valve leaflets. As the valve opens and closes with incredible force, thousands of times an hour, tiny pieces can break off and get sent flying into the bloodstream. These are called septic emboli because they are infected clots. If these tiny infected clots travel to the small blood vessels in the pads of the fingers and toes, they can cause a painful inflammatory reaction, resulting in raised red bumps called osseous nodes. If they land in the vessels on the palms of your hands or the soles of your feet, they can cause painless, flat red or purple spots called Janeway lesions. Seeing either of these is a medical emergency. It is a clear sign that not only is there a dangerous infection breeding in the very center of the heart, but it is also actively showering your entire body with infected clots, which can lead to abscesses in the brain, spleen, kidneys, or elsewhere. And now for the one we've been building up to. The combination of signs that points to a critical event happening right now. The ultimate secret number 1, the critical infection cluster. The number 1 sign on our list isn't actually a single sign. It's a powerful cluster of the clues we've just discussed that, when seen together, represent a critical, time-sensitive warning. This is the infective endocarditis triad: splinter hemorrhages, osseous nodes, and Janeway lesions. While any one of these signs on its own is a cause for concern, seeing them appear together, especially in the context of feeling generally unwell, having a persistent fever chills, or unexplained weight loss, is one of the most serious presentations in all of cardiology. It is your body screaming that there is an active, destructive infection growing on the most delicate and vital machinery inside your heart. The splinter hemorrhages are the distant smoke signals of this fire. The Janeway lesions and osseous nodes are the clear evidence that flaming embers from that fire have landed throughout your body. This is not about a chronic condition that needs to be managed over time. It's about an acute, life-threatening infection that requires immediate hospitalization and aggressive intravenous antibiotic treatment to prevent catastrophic damage to the heart valve or a major stroke. This is why we saved it for last. It is the visible evidence of an internal crisis. Recognizing this cluster, this critical warning, isn't just helpful knowledge, it could save a life. And there you have it. We've journeyed from the more common clues like swelling in the ankles all the way to the profoundly serious signs of a hidden heart infection. Each one is a piece of a story your body might be trying to tell you. We covered a lot of ground today, from our first clue of pitting edema, to the subtle observational signs in our eyes and earlobes, all the way to our game-changing revelation, the critical infection cluster. Each one is a stepping stone to becoming a more empowered advocate for your own health. So which of these insights resonated with you the most? Perhaps it was the simple fingernail test for clubbing, or maybe the surprising connection between your eyelids and your arteries. I'd love to hear your thoughts. Please share them in the comments below. If you found this journey valuable, please give this video a thumbs up. It truly helps others in our community find this information. And don't forget to subscribe and hit that notification bell for more deep dives into your health. Until next time, stay curious, stay healthy, and keep listening to the whispers of your own body.